Hi, I'm Seth Gregory, and I'm here with Dr. Glenn Cohen. Dr. Cohen, what's your job exactly?
I'm a orthopedic hand, wrist, and elbow surgeon.
So what does an orthopedic hand, wrist, and elbow surgeon exactly do?
I take care of people's problems limited from the fingertips up to just above the elbow with all sorts of techniques. Surgery being the last resort, but doing injections and splinting and casting and therapy and things along those lines.
So I had a specific question. I heard about something called carpal tunnel syndrome. What is that?
Carpal tunnel is where the median nerve, which everybody has in both of their wrists, goes from the forearm into the hand, and where it crosses inside the wrist, what happens is there's an area where it can get tight and where it can get squeezed. And there's a lot of theories as to why that happens, but what you have to know is that the nerve sits inside of a tunnel, and instead of it being like this, it's like this and it's too tight.
So it's basically the tightening of a nerve around the tunnels.
It's the tightening of the tunnel around the nerve, and it's the contents of the tunnel that make the nerve get squished.
So what could happen if someone had very serious carpal tunnel syndrome?
Okay, I have people who come in here and they'll tell me I was slicing a bagel or an avocado and I didn't realize, but I was cutting into my own finger and I couldn't feel it. So if you have really bad carpal tunnel and you let it go without treatment, what'll happen is you'll have severe numbness in your fingers to the point where you can cut it and not feel it.
That's pretty crazy. So what is the best procedure to fix carpal tunnel syndrome?
So the best thing to do is to identify that you have it at an early stage. And if you have numbness and tingling in your arm, or if you have burning pain in your fingers, or you have your fingers going to sleep, or you wake up at night and your hand's on fire and you have to shake it out, those are all possible signs for carpal tunnel, as well as other things. So you want to see somebody who's a board certified orthopedic hand specialist to make sure that we know what you have and we start treating it. So we start treating it with splints and therapy and things of that nature. Then we can jump up to injections or surgery if necessary.
Yeah, the thing is that my dad also has carpal tunnel syndrome. He's also one of your patients, and I'm also a patient of Dr. Cohen. He's a very excellent doctor.
Thank you.
So, my dad, how serious is his carpal tunnel syndrome?
I don't remember specifically because I haven't reviewed his chart, and he probably wouldn't want me to discuss it in front of your whole class.
Okay, so I'm Seth Gregory.
And I'm Dr. Cohen.
And that was an interview with Dr. Cohen. See you guys.